have West Midlands Health Technologies Cluster. And so again, Emma, we've worked together for a number of years, but introduce yourself and tell people a bit about West Midlands Health Technologies Cluster and what you do.
Yeah, sure. So nice to be here, everybody. Thank you for having me. So my name's Emma Yeap. I'm Cluster Manager at West Midlands Health Technologies Cluster. So I get asked all the time when I'm out and about, what is health tech? So the clue's in the name. It's obviously a combination of health and technology. Health technology is defined by the World Health Organization as the application of organised knowledge and the skills that form devices, vaccines, procedures and systems, all developed to solve health problems and improve quality of lives. So these devices and equipment are instrumental in helping healthcare providers to achieve better patient outcomes, lower the healthcare costs, improve efficiencies, enable new ways of engaging with patients and empowering patients to take care of their health. So as you know, as a society, we are using digital health more and more. I suspect all of you pretty much have a smartphone with a health app. You use a watch maybe to collect data on your steps. If like me, you always need to continue and walk around the block one more time, you're taking action on your health and well-being. So health tech is essentially out there already, but it's forever evolving. So a little bit about the cluster. We are a business-led organisation established back in 2020 to maximise the potential of the health technologies sector in the region. So the aim is really to raise the profile of all the fantastic organisations that are emerging within Birmingham and the West Midlands. So we do this by helping these businesses successfully scale. So we provide them with knowledge, insight and support. Through a number of activities, we do showcase events and give them access to resources as well. So at the cluster, we see no boundaries. So we work with businesses right across the wider West Midlands. So this includes right across to Shropshire, right up to the border of Wales, right across to the border of Warwickshire, bordering with the Cotswolds. So there are challenges reaching businesses in more remote areas and rural areas. So recently the team ventured across to Shropshire, which was exciting, to host a digital health event. The first of its kind ever in Shropshire, which was quite shocking in this day and age. But there was a real appetite for business-to-business engagement. So we're really conscious of continuing this level of support for businesses, particularly with hospitals that require health technology in supporting people that need to be discharged from hospital and require sort of remote care. So who's part of the ecosystem? So there's kind of two categories that they fall into. So you've got the creators and you've got the enablers. So the creators are essentially like the larger corporations, the health and medtech SMEs, startups, spin-outs from universities, and high growth ventures as well. So the enablers are the ones that are the sort of like the universities, the R&D institutions, all our NHS trusts, including mental health, community care, investors, funders, any kind of support function as well, and also local government and of course yourselves, the Combined Authority. So this is the cluster's health tech ecosystem, which gives you a bit of a flavour of the broad range of organisations that we're actually working with right now, and we're continuing to you know, engage with. So if you can see this, this is a visual which was captured as part of our Health Tech Day. as part of Birmingham Tech Week last year. And for me, it really encapsulates what we're about. So, which is about showcasing our amazing talent in the region. So we do this by promoting the new kids on the block in health tech and the ecosystem, and then also connecting the dots, you know, making it easy for people to access support and information and insights to different points of their journey. So these are just a few stats from last year. So we've been running for 2 years now, and I've got to say I'm really proud of the work the team has done to date to achieve this. As you can see, our reach covers over 8,000, which we're continuing to grow and make an impact in the region.
Excellent. And do you have any detail that you can share with my Combined Authority colleagues on the kind of potential impact of growing this kind of health and medtech area?
Yeah, I mean, for us, we're looking at you know, investment into the region. We want to make the region attractive, so businesses actually relocate into the region. We also want to attract investment into the region as well. We're never going to be the Golden Triangle, which is based, if you're familiar with it, it's based sort of just outside London. Big pharma companies, AstraZeneca, Pfizer, all based there. And what happens with these sort of clusters is that more people tend to actually join the area. So their Golden Triangle is golden. We're never going to beat that. But from a med tech and health tech perspective, you know, we are well ahead. I would say we're up there with the best in the UK. So yeah. So
excellent. So new jobs to be created.
Yeah.
High value firms, etc.
Absolutely.
All doing some amazing things and technologies that help us as human beings live long and prosperous lives. So that's
absolutely.
Also absolutely fantastic.
Absolutely.
Brilliant.
I just wanted to say this is the team. Sorry. So there's only a few of us. There's 5 in the team. We're a friendly bunch. So get in touch if you'd like to hear more, or if you think we can help you in any way. We're based across the region. So one of us, Solihull, Warwickshire, Birmingham, Coventry. So yeah, just get in touch if you'd like to hear more.
Fantastic. And just before you go, have you got any examples of some big ticket things that are going on? Because I know so much exciting activity in this space.
So just refer to my notes if that's okay. So yeah, for me the big standouts are digital pathology. So we have one of the top centres in the UK, based over in Coventry and Warwickshire. So they're using AI and machine learning to detect cancer cells at a minute level. So the human eye would never be able to detect that. So that's one great thing that's happening in the region we need to shout about. Also, we've got YouTube Health. So everybody knows YouTube, but they're now moving into the health arena. And by that I mean they've got a health platform, and they're doing some work with Birmingham Women and Children's Hospital, and they are making, I guess, really working with the children and making it more accessible for them to access information and to look after themselves. So that's another great thing. They're also coming to Birmingham Tech Week as well, and they will be speaking at our Health Tech Day. So really excited about that.
Brilliant.
We've also got Skyfarer, which is a drone company which are delivering medical supplies across hospitals across the region, which is awesome. It's like something out of a sci-fi movie, so that's great, and that's the first of its kind in the UK. We've got Pioneer Data Hub, one of 7 in the UK again, and transforming how data is used to improve healthcare. And then last but not least, we've got the Birmingham Health Innovation Campus, which is being built in Birmingham, due to open this year. Really exciting. So that will become the UK's epicentre for health medtech. Collaboration between Bruntwood and the University of Birmingham. And the idea is that businesses can access expertise to develop their products, their services, and so forth.
Excellent. So lots of collaboration, lots of opportunities
Absolutely.
for growth, all the things that we want to see.
Absolutely.
That's fantastic. Well, thank you very much. I feel I wish we could give people a round of applause. Let's see if it goes. Okay, so Emma, what are the gaps in the market in the health tech sector, and where do we need to grow and develop skills?
Yeah, so I guess really the skills issue is huge. On one side, you've got clinicians, doctors, nurses, and obviously they need to kind of upskill to be more technical. And then you've got like the engineers, the computer scientists, and you kind of need a bit of a mix of that, and also the academics as well. So you need a bit of a mix to upskill. So that's kind of a grey area at the moment. One of the things I'm really passionate about is trying to encourage the younger generation into sort of that industry. And quite surprisingly, young people don't even know how to access health tech or med tech. It's not really a straight route into it. So that's one of the things that I want to try and achieve as part of the cluster over the next few years, is just raising that profile. In terms of gaps in sort of the market, I think there's so much going on at the moment in terms of apps. I mean, look how many apps we have on our phones. It's quite crazy. How would somebody actually know what app to use? So in terms of innovation, we are, at the forefront in the Midlands, in terms of looking at sort of ideas. I think really that the innovation happens in, would you believe, in people's sheds, in garages. I've got one guy in Shropshire who has been tinkering away for years and created a new version of a wheelchair. And this wheelchair is pretty much like a Segway, and it's an upright wheelchair. So it cuts out sort of the level of where somebody's taller and they can actually stand up. So you can imagine what that's like for somebody in a wheelchair to actually be looking somebody in the eye. So it's things like that where just kind of almost those beacons of excellence, I call them, which are just those wow factors. So that's kind of what I'm looking for when I'm looking for gaps.
Brilliant. For some amusing reason, I just have this vision of his neighbours just seeing him kind of scooting back and forth as he's developing.
It's actually quite funny. He was telling me, although he's created like his first or second prototype, he had to scale back the speed.